everyone. I'm Erin, and I'm with Sabrine.
Hi.
And we decided to do our policy brief project regarding the full practice authority of advanced practice nurse practitioners. Currently in Wisconsin, their advanced practice nurse practitioners have reduced practice authority, meaning they are required to have a collaborative agreement with another health professional, primarily a physician, throughout the entirety of their career. However, there are some states that do grant advanced practice nurse practitioners full practice authority, including Minnesota. In Minnesota, in 2014, Senate Bill SF-0511 was passed. The bill was sponsored by Senator Kathy Sheeran and co-sponsored by Senator Mary Cliffmeyer, John Marty, Chris Eaton, and Jeff Hayden. Fortunately enough, it was passed in May of 2014 and was put into full effect January of 2015.
So this bill basically does create a separate license for the nurse practitioners to let them practice independently without having to go back and forth to a physician. But it does require that a nurse practitioner work under a physician for about a little over 2,000 hours, kind of like a residency type thing. The definition of this bill is to promote health, disease prevention, health education, counseling, everything on here basically, providing health assessment, screening activities, diagnosing, treating, and facilitation of patient management, ordering, performing, supervising, interpreting diagnostic studies, consulting or referring to other healthcare providers just as a physician would, and it also increases accountability for a nurse practitioner due to no longer working under a physician.
Yeah, so overall what the bill does is it kind of modifies the current advanced practice nurse practitioner definition and overall broadens what they do. So, presently in the United States, about 2/3 of Americans see nurse practitioners for their primary care needs. It's said that nurse practitioners are becoming the healthcare provider of choice for millions of patients nationwide, maybe even worldwide. So the problem with advanced practice nurse practitioners having reduced practice authority means that patients have decreased access to care. So primary care is projected to rise over the next 5 years, whether it be due to population growth of the baby boomers or to expanded health insurance. However, either way, vulnerable populations are the primary population mostly impacted by this change, because with an increase in demand and a decreased access, it can arise some problems in public health.
So the summary and intent, basically, how will the bill impact the cost and the quality of care? It will increase access to care, more primary care providers for the vulnerable population or anybody else. It does decrease cost of care. Nurse practitioners do get paid lower. And according to the Medicare, they do the fee-for-service. Studies have shown that increasing access to the nurse practitioner primary care will not increase costs for Medicare program and will be cost saving according to the article. And then definitely significantly fewer emergency room visits, lower readmission rates, and among all the vulnerable populations. Also, nurse practitioners do provide high quality care equivalent to the care provided by physicians.
Also, so states are considering relaxing scope of practice standards for nurse practitioners mostly, because this is a way to increase access to care. In states that have already passed relaxing scope of practice laws have seen a dramatic change in care provided. So there are stakeholders that promote full practice authority for nurse practitioners, including the Institute of Medicine. Institute of Medicine posted their their statement in 2010 recommending that nurse practitioners practice to the full extent of their education and training. That includes practicing independently, not having to work under a physician. So they recommended that regulatory practice barriers be removed so nurse practitioners can practice to the full extent that they were trained to do. In addition, the American Academy of Nursing, which is a nursing organization which helps pretty much make practice guidelines according to evidence. But they believe that full practice authority for nurse practitioners will transform primary care. Therefore, restrictions should be removed so they can practice independently, therefore make changes in healthcare.
And obviously, there's also stakeholders against the full practice authority, mainly the medical physicians. This will decrease the demand for physicians providing primary care and will also decrease job availability for the physicians. And then Centers for the Medicare and Medicaid Services, for some reason, they're also against it as well. They state that the CMS requires that hospitalized Medicare patients be under the care of a doctor of medicine or osteopathy, according to one of the articles in 2017 by Dillian and Gary. And then another one is the American Academy of Family Physicians. They assert that APNPs cannot fulfill the need for a fully trained physician, according to the same article as well. So it's mainly physicians that might be against this full practice authority. And like I said, maybe because mostly for the decrease of demand and the decreased job availability for physicians.
Yeah, so for the CMS, it seems like the primary reason they are against full practice authority is because a lot of their regulatory processes are guided towards physicians. So it requires that bills be put under a physician's name and number and not so much a nurse practitioner's. So although there aren't a large amount of negative unintended consequences, there are some good unintended consequences of Bill 511 being passed in Minnesota. So although these statistics are mainly guided towards states overall that have passed full practice authority, it does emphasize the impact in care. So within all states that have passed full practice authority guidelines for nurse practitioners, they've seen a 13 to 15% increase in visit quality provided to adults, as well as a 17 to 27% increase with children. Also, although it was intended that there would be an increased access to care, statistics have shown that nurse practitioners with full practice authority are more likely to serve young, female, non-Caucasian, disabled, and vulnerable populations as compared to physicians. So these are the populations that are more likely to be served under Medicare and Medicaid. And also nurse practitioners are more likely to practice in rural environments. So these are mostly those health professional shortage areas where primary care providers are rare and widespread. So nurse practitioners are more likely to go to the areas that are underserved. So I think as emphasized in a previous slide, nurse practitioners perform as high as physicians in multiple respects. So they do provide high quality of care, but they also perform as high as physicians with considering health outcomes, promoting patient compliance, increased patient satisfaction, as well as appropriate treatment and resolution of conditions. So although nurse practitioners don't have that PhD that physicians have, they have been shown to provide the same accurate, good quality care. So with this being said, because nurse practitioners get paid generally less than physicians, there's been a decrease overall price for visits. So there's an average decrease in office visits from $103 per visit to $96. And although that doesn't seem like a whole lot, when it comes to being reimbursed or through insurance coverage, that's a lot of patients, and it comes up to be a lot of money. Overall, states granting nurse practitioners greater scope of practice authority tends to exhibit an increase in the number and growth of nurse practitioners. So states that allow nurse practitioners to have more autonomy are creating more nurse practitioners to go into public health and to go to provide primary care for these vulnerable populations.
So for the fiscal estimate, due to the advanced practice nurses having full practice authority, there's going to be more than 6,500 advanced practice nurses that had already acquired initial licensures. So an application, per applicant, it would cost about $105, and which brings a total income of $682,000 and $500 currently. It's anticipated that there will be a growth of 195 applicants per year, which will provide an additional $20,000, $475 per year. Half of those nurse practitioners are then required to renew every fiscal year, resulting in an anticipated additional $276,000. So we do expect to hire, well, in one of the they did expect to go ahead. So in a fiscal document provided by Minnesota, they expected to hire one full-time customer service specialist to process the application, which is about $58,000 per year as well. There was a study by Duke University as well that shows that nurse practitioners would generate at least $6.4 billion in healthcare savings, and that was for Pennsylvania over the next decade. The increase in supply is likely to also have an effect on prices as well as access and utilization. Here's a little expenditures form that I had found. So for expenses for the year of 2018, they were estimating that salaries would be $121,000. The computer services would be $2,000. Postage and communication, it was like a one-time expense. It was $4,000. Rulemaking was $10,000, and some other costs for discipline costs were $108,000. Total for 2018 is $231,000, and then those were basically more of like ongoing expenses, and the one-time expense was only $86,000. So for nurse practitioners to be to practice with full authority in Minnesota, I believe that is not too much money.
Yeah, so initially the expenses that were required were just within that first year and really hasn't required a whole lot of costs going in since that first year the law was passed. So I know we pretty much reviewed this in previous slides, but the stakeholders that are positively impacted by this are those nurse practitioners. So I know we stated that the Institute of Medicine as well as the American Academy of Nurses were for full practice authority, but nurse practitioners really fight for this because it increases their autonomy and increases overall population health. And as stated previously, those physicians are the stakeholder group that are most negatively impacted because it decreases demand for physicians and it decreases job availability because nurse practitioners are mainly impacted by more primary care providers of nurse practitioners. So overall, we recommend that all states should move to grant advanced practice nurse practitioners full practice authority. So new APNPs should, however, have those required hours working under a physician or a experienced nurse practitioner because this will provide them the experience and the familiarity within the healthcare setting that they need. It'd be kind of terrifying if a nurse practitioner just hopped into the healthcare setting without any prior knowledge and prior experience. So exactly what Minnesota did, they required that new nurse practitioners have a total of over 2,000 hours of practice underneath someone who's more experienced before being allowed to practice independently. So overall, what will determine success of this bill, or already has determined success of this bill, is increased health outcomes, maintained quality of care, increased access to care, as well as decreased costs of care. Here are our references, and I hope you enjoyed
Thank you.
our presentation.